Of the 3 million people in the United States who have glaucoma, 1 million are African American. This means that although we comprise 15% of the total population, we account for more than 30% of all cases of glaucoma. Glaucoma is 5 times more likely to occur in African Americans than their white counterparts. And glaucoma is the second leading cause of blindness in the country. Yes, blindness. African Americans aged 45 to 65 will be blinded by glaucoma at a rate that is up to 17 times higher than Caucasians in the same age group. When we are diagnosed with glaucoma, the disease is often more aggressive than it is in the general population. Glaucoma is a condition that approaches quietly and without warning. By the time you experience any vision loss, it has already done irreversible damage. Once detected, however, glaucoma, the same disease that is believed to have robbed a young Ray Charles of his eyesight, can be managed. Your vision can be protected. The key to successfully managing glaucoma is in testing for its presence before you experience any vision impairment. Loss of vision is typically the only symptom you will encounter. Glaucoma is a disease characterized by high intraocular pressure, or high pressure within the eyes. Aqueous humor, the fluid that circulates in your eyes, builds up due to slow drainage. The pressure in your eyes increases to the point where your optic nerve, the nerve responsible for carrying information from your eyes to your brain, begins to tear and detach. Once this happens, an irreversible loss of vision occurs. Anyone can develop glaucoma. However, some high-risk factors include having a relative with the disease, being over 35 years of age, nearsightedness, being a diabetic, having high blood pressure, and having a history of eye surgery or injury. In its earliest stages, glaucoma is painless and symptomless. One typical symptom, loss of peripheral or side vision, often presents itself before you experience more dramatic vision loss. With the turn of the head, however, you can unknowingly compensate for a loss of peripheral vision. This is why most people who experience it aren't even aware of the impairment. By the time symptoms of glaucoma do appear, those symptoms have become permanent indicators of damage that cannot be treated. The only way to prevent this is to detect the disease through glaucoma testing. Testing for glaucoma is the single most effective thing you can do to protect your vision. Because African Americans have a higher risk of glaucoma, if you are between the ages of 20 and 29, you should be screened for glaucoma every 3 to 5 years. Between the ages of 30 to 40, screening should increase to every 2 to 4 years. You should be screened every 1 to 2 years after you reach the age of 40. Ask to be tested for glaucoma. A typical vision test does not usually include screening methods that will find the disease. Glaucoma can be detected by a dilated eye exam. This is an examination that can identify optic nerve damage. A tonometer might also be used to determine your eye pressure. You might be given a visual field test in which your range of peripheral vision will be measured. If it is diagnosed early, the management of glaucoma can be very successful. Only 10% of all treated cases result in continued loss of vision. Treatment for glaucoma usually requires administering medication to your eyes through eye drops. These medications work to lessen production and/or improve the drainage of the pressure-building fluid in your eyes. In the case of open-angle glaucoma, the most common form of glaucoma and the most likely to strike African Americans, laser surgery can be a quick and painless way of lowering eye pressure. It will also prevent the onset or progression of vision loss. It's not surprising that African Americans suffer the most severe consequences of glaucoma when statistics show that we are twice as likely as our white counterparts to not even know what the disease is. What this reveals is that in the fight against glaucoma, knowledge has the potential to be one of our most valuable allies. While you're here, ask your doctor or other medical professional about developing a screening schedule that can protect your vision from the debilitating effects of glaucoma. Your doctor will also be able to address concerns you might have about any loss of vision, vision impairment, or eye pain that you might be experiencing. Take responsibility for your visual health and well-being. Ask questions and seek answers in the form of proper treatment.